Hey, what's going on, guys? This is your boy, Dr. Collins. Listen, on one of my segments of Ask Dr. Tooth. Listen, today we're going to talk about something that's really cool, man, I think, and it's why do I need my wisdom teeth extracted, right? And is it a gimmick? I don't know. Sometimes, what you're going to get from me is integrity. I'm going to tell you the real Holyfield, right? Sometimes you don't need your wisdom tooth extracted. When they grow in straight and you're able to get back there and clean, guess what? Don't let nobody tell you to do that, okay? But if you have problems with inclining of the tooth, let's say, for example, you have a wisdom tooth that's actually inclining to and it's actually hitting another tooth. Well, sometimes it's almost like if I put my hand on your shoulder, right? If I put my hand on your shoulder and if I leave it there, then I can create a bruise right here, right? Well, it's the same thing. If you have a tooth that's leaning against another tooth, let's say the tooth is standing straight and you have this wisdom tooth that's leaning and putting pressure on there, well, sometimes bacteria can cause decay on this tooth, on the one that's standing up, okay? So we don't want that. So we go ahead and pull that tooth so that way we can help prevent it from causing problems to the other tooth. Also, sometimes you will get a cyst around your wisdom tooth. That's another issue. A lot of times we want to also pull a child's tooth that's actually about 14, 15, 16 years of age, where their roots of the wisdom tooth hasn't completely fully developed. It's the easiest way to go ahead and pull that tooth. All right, so that's one way. Doing ortho, sometimes you need a room for space, okay? Sometimes your mouth isn't big enough, all right? So those are some of the things that we need. Also, decay. Sometimes the person who, when that tooth is so far back there, I know you brush all the time, man. I see you brushing all the time, but some of you don't brush good all the time though, right? So sometimes we still get some decay in the back, especially in the back of that wisdom tooth, where we just kind of go, and that's it, right? That's it, right? So at the end of the day, we need to go ahead and sometimes pull that tooth because it's leaving bacteria back there, right? So we'll pull it because of that. Now, after we do all those reasons, we know that we need to pull because sometimes decay, we need to pull because sometimes we have ortho issues, we need to pull sometimes because it's leaning against a natural tooth, and it can cause that tooth to have decay. And sometimes we pull because there's a cyst or sometimes a systematic problem going on with the tooth, all right? Or just pain, all right? Next thing is, are there complications when you extract a wisdom tooth? And more so, yes, more so than any other tooth in your mouth, because that tooth is so far back there. Sometimes it's actually in your angle. So you put your hand right there. You can feel how that bone just kind of turn around, right? We call it the angle of the mandible, right? And sometimes that tooth is embedded deep into that mandible. So when you pull that tooth, you can actually, sometimes when you extract, somebody goes home and they go on this hot date and whatever, and they get on this steak, they just got the tooth pulled 2 days ago, and they go and they eat this big old hard piece of meat, and they just be eating, chewing, and all of a sudden, clack, they crack the jaw, okay? That's a possibility. Sometimes trismus is a possibility, okay? TMJ issues because of extraction. Also, sometimes you can damage the nerve. If that tooth is sitting beneath that nerve or right at the nerve, sometimes you can damage it to a point where your whole lip is completely, but your tongue is completely paralyzed. You don't even feel it, all right? So there are so many different things that can happen when you're doing an extraction on your wisdom tooth. So make sure you get some good advice and you see a good dentist or a surgeon that can do a good job for you, okay? Sometimes you can actually remove too much bone if you don't know what you're doing in that process, all right? So listen, holler at your boy, Dr. Collins. I'm doing my segment, Ask Dr. Tooth. All right, if you can, like me. All right, appreciate you.